you ever had the experience where you heard about a skincare product that was super hyped up in the media, and then you went home, you used it diligently, and it just didn't seem to deliver the results that you were expecting? Well, I'm Dr. Afton Cobb. I'm a dual board certified dermatologist and Mohs surgeon, and today I'm going to be talking about debunking skincare myths. And this is something that's super important to me as a dermatologist. It's very annoying actually to hear about all these things in the media that are hyped up, that everyone thinks they have to be buying to have perfect skin. They really just aren't worth the money, and some of them actually can be unsafe. Today I'm going to be talking about 8 skincare products that people frequently talk about, patients ask me about, and we'll go into whether or not they're worth the hype. I'll be saving the worst ones for last, so stay tuned throughout the video so you can make sure that you don't get fooled by using any of these skincare products. Before we get started, make sure to hit that little subscribe button so you can stay tuned with my YouTube community, and click the little bell icon so you can get notifications whenever I post a new video. Product number 1 that I think is superfluous and not necessary for any skincare routine are face mists, especially the really expensive face mists. Face mists definitely are not necessary to your skincare routine, and as you'll probably hear me say over and over in this video channel, less is more with the skin. And especially if you're trying to save money and be intentional about the products that you have and not overwhelm yourself with a ton of things, you definitely don't need a face mist. The time where I would use a face mist is if I was like sweating my butt off outside in Arizona in the summer in 100-degree weather, or at a concert or outside music festival, something like that, where you just wanted like a refresher or something. But beyond that, you really don't need a face mist. Product number 2 in the world of unnecessary and overhyped products are pore strips. So pore strips are not great for the skin because they do have adhesive on them that can kind of rip off your skin barrier. That can lead to irritation, dryness, and the pore strips don't completely remove all of the debris in the pores anyway, so you're leaving stuff behind, and the pores are going to refill, so it's like a temporary hack. I would say the main benefit to using a pore strip is for entertainment purposes. I think it's pretty interesting to see it come off, and it's always fun to look at it there, but it's not a way to actually prevent the pores from filling up and clogging and actually get any long-term results. So I would avoid getting pore strips and focus more on something else that can treat the reason behind clogged pores. So the reason why we get blackheads and whiteheads, so those are called open and closed comedones, the reason why we get those is as the skin cells mature, they can get kind of sticky and they can get kind of built up, and they can clog the pores, and then it fills up with even more dead skin cells and debris and sebum, which is like the oil on the skin. And so if you use products that help even out the maturation of the skin cells and how they grow and exit the skin surface as they go through their cycle, you're going to be much more effective at unclogging the pores. So the products that can help doing that are like topical retinoids, which you'll hear me talk about a lot on this channel, and also ingredients like salicylic acid that can be a little bit more effective even than like a glycolic acid, because salicylic acid is a little bit more lipophilic, meaning it immerses better with fat, and so it can penetrate a little bit deeper into pores and oils and be more effective at kind of cleansing out the pores. Product number 3 that's overhyped: masks. It's really fun to get together with all of your girlfriends and have a little beauty night and put on face masks, and I love that idea for a fun girls get together, but to be honest, I don't really love face masks. And the reason is because when you want to try and achieve skincare goals, a lot of time the way that we achieve skincare goals is by doing consistency in our skincare routine. And good skincare is doing something consistently over time, and it can take a while before you see the results. So things like face masks, where you kind of do like a one-off treatment and a one-off face mask. It might give you a little bit of brightening or something in the short term, but it generally doesn't lead to long-term success in getting healthy, glowing skin. And there's just a high chance that you can get reactions. There is a lot of different ingredients in those face masks generally, and sometimes they can be quite irritating. Sometimes they can even cause allergic reactions. So even though it's super fun to think about putting on face masks with your friends and having a little spa day, I generally recommend just avoiding face masks. Product number 4, cleansing devices. There's a lot of really interesting products out there, like the little eggs and little orbs you can use to use devices to clean your skin. In general, I think that this is overkill. You don't need to have a device like that to clean your skin. And in fact, it can potentially cause problems depending on the device you get. Sometimes if they're too firm, too harsh, too much pressure, that can cause irritation to the skin, disruption in the skin barrier, and it can actually lead to reactive problems where the skin reacts because it's been too traumatized and too manipulated, and so it gets angry and gets inflamed. The other thing about cleansing devices is that if they're not cleaned appropriately, you're using that same thing that's been touching your skin where there's bacteria and oil and dirt, and you're reapplying it on the skin and you're re-delivering it to the skin. And that's my biggest concern with them. A lot of them will be touted to be like self-cleansing, or maybe you think you're cleaning it enough, but are you really? Kind of goes in that same category for me as using washcloths and loofahs. Those are two things that I also really don't like, and that's the first step that I'll ask my patients if they're coming in with eczema or other problems with their body, dry skin, irritation. The first thing that we do is make sure that they're not using a washcloth or a loofah, because those can also harbor bacteria and also be too harsh. Anytime there's too much manual manipulation of the skin, it can cause a reactive process where the skin gets more built up with thickened skin or gets more irritated. So in general, don't waste your money on the cleansing devices. You don't need them, and they do have the potential to cause harm. Product number 5, wipes. I would venture to say that most dermatologists hate wipes. And I hate wipes for a number of reasons, and one of them is because wipes contain a lot of preservatives, potentially fragrances, and other additives that can cause irritant or allergic contact dermatitis when they're repetitively put on the skin. For example, there's allergens called methylchloroisothiazolinone and methyl isothiazolinone. Ooh, that was a mouthful. And those can cause allergic reactions in the skin. Sometimes just the wet, dry cycle of using wipes repetitively can be harmful to the skin barrier. And that goes for when you're using them on the face, and especially if you're using them in the genital area. Typically, that's something that when I'm doing an assessment with patients, that's one of the first things that we try to make sure that the patient is avoiding, and we get that off the table. Don't use wipes. There are circumstances in which I will use wipes, and that's a very limited circumstance, and that is when I'm in the backcountry and I'm really dirty and really sweaty and I'm not around any kind of source of water. Then I might use a wipe, and I do it usually begrudgingly so, but in general, wipes are not good for the environment. And even the ones that say that they're biodegradable still take a really long time to degrade. In general, I would just say skip the wipes altogether. You can use your hands to apply a cleanser or soaps on your body, or you can use clean cotton balls to apply other products and avoid the wipes. Product number 6, cellulite creams. Cellulite creams just are not helpful. And the reason why we have cellulite is it's more of a structural anatomy type problem than something on the top layer of the skin that needs a product to help improve it. And what I mean by that is that cellulite occurs when the fibrous septae, the fat kind of puckers and bulges through it in different places, and so no amount of cream is going to change that. So don't waste your money on expensive cellulite creams. The skincare world and the world of marketing loves to target our insecurities, and that's why you'll see all these cellulite treatments and creams out there, but there's no scientific evidence that those actually help. Cellulite is a very complex issue. It's related to genetics and hormones and your own anatomy, and even weight loss and exercise doesn't really help with cellulite that much. Cellulite is caused by a complex interplay of different factors such as hormones, genetics, a little bit is related to lifestyle and diet and exercise. Sometimes diet and exercise doesn't even help, and the cellulite can occur in people who are thin and fit and active, and it's just related to how the skin dimples from the fibrous cords of the connective tissue. But because it's more of an anatomical issue, creams sitting on the surface of the skin really aren't going to do a whole lot. So if you're really concerned about your cellulite, save that money for procedures that might be more likely to help you. Product number 7, I'm going to say eye creams. And this might be shocking to some people, but I personally don't think that eye creams are worth it. And that's because I think that you can achieve the same goals that a lot of the ingredients in eye care creams have. You can achieve those same goals by just putting your moisturizer on that area. So for example, a lot of eye care serums will contain hyaluronic acid because it helps draw moisture into the skin under the eyes to help plump up the skin so that it looks less tired. And you can get moisturizers that have hyaluronic acid in them and just use the moisturizer in that area. Some of the eye creams will tout having caffeine in them or peptides or lightening agents, and it's okay to try those, but a lot of times the reason why people are using under eye creams is because they're concerned about under eye bags or circles or discoloration. And for the vast majority of cases, the reason for that under eye discoloration is usually related to the anatomy of the face. And so for some people, as we get older, we lose some of the fat pads under here. We lose some of the bone begins to resorb, so we lose some of the scaffolding that the skin and the tissue sit on, and so that can lead to a more sunken appearance, and it can cast shadows under the eye, and that's why the eyes can look darker sometimes. Or if there's less subcutaneous fat and tissue here, you can see the blood vessels through the skin a little bit easier, and that can lead to a little bluish tint. And so a lot of times when we're approaching under eye problems, we're going more down the realm of you're looking at fillers to rebuild that scaffolding or re-give the volume underneath the eyes. And sometimes people will use lasers even to do like tightening around the eyes, and you're gonna have a lot more benefits and results if you do something like that than using an under eye cream. There's nothing wrong with using it per se, but that eyelid skin is pretty delicate under the eyelids, so you can be more prone to getting irritation as well. And if you get irritation, you can get more darkness under the eyes. So in general, I'd say ditch the eye creams. You have so much else in life to worry about and things to do. Why add one more thing into your routine when you could just use your normal other moisturizers? And the final product number 8 that I think is overhyped and you have to be really careful about are home microneedling devices or other home treatment devices such as home cryotherapy or home freezing devices. So the home microneedling devices I don't like because it can be very unsafe. If you are using a microneedling roller, so you're delivering tiny little pricks into the skin, there's a lot of risk with that of delivering bad things into the skin, like bacteria, dirt, or if you put products on afterward, those products can be pushed into the skin, and if it's the wrong type of product, it can cause problems and reactions in the skin. Certain things are not meant to be delivered deeper than our epidermis into our dermis, and it can be bad when they're delivered into the skin. Also with home microneedling devices, if you're not doing it appropriately and it pulls on the skin, you can get little tears in the skin, could lead to scarring. So that's something that I would avoid. And in terms of the other product that I mentioned, the home cryotherapy or home freezing devices, a lot of my patients will come in and they'll have a wart they've been working on for a long time on their own, and they've been using a freezing device to try and get rid of it. And spoiler alert, the home freezing devices just don't get cold enough to actually be able to do the work to destroy it. So you're just causing yourself pain, potentially damage to the skin, and unlikely to actually get the results that you want with that. There's also a potential for discoloration, for scarring. So I would say save your money and avoid home microneedling or home freezing devices. Those are things that it's just worth it to save up and maybe get done as an in-office procedure. If you like this video, make sure to hit the like button. Don't forget to subscribe so you can stay tuned with my YouTube community, and hit the little bell icon so you can get notifications when I post new videos. Thanks so much for staying tuned. I'd love to hear what you think in the comments. If you have any questions that came up about hearing this, or if there was anything that surprised you, let me know. I know a lot of these things can be polarizing topics, and these are all my personal opinions based on what I've seen in my practice and as a board certified dermatologist. See you in the next video.